Hello, everybody. This is Carmen Heredia. I am the Chief of Arizona Operations for Vital Soul, and I'm going to cover this presentation on the new productivity expectations that are happening this month and that you're going to see in all of 2019. A lot to review here, but first I'm going to cover why are we making these changes. There are two main reasons, and they both have to do with the Arizona Complete Care changes. Now, I want to give a shout out to the SMI team because they were not affected by Arizona Complete Care, but they're troopers and they're still making these changes, and that really makes it easy for the administrative departments. Everybody else was very much affected by Arizona Complete Care. And as you know, we went from having one major insurance plan under Medicaid to 7. And I don't know if you realize, but the 7 health plans all reimburse differently. So that means that if you have your caseload and there's some that are going to be Mercy Care patients and some are going to be United and some are going to be Banner patients, well, now you have a case management rate for the reimbursement looks different for case management for your Mercy patient versus your United. And some of them pay higher. So your United patient might pay really high for case management, but your Banner patient might pay, the insurance company will pay less. And it's very different depending on the service code. And if, it's unfair to staff, that depending on the patient volume, the credit for your productivity would be different because of the performance being based on dollar amounts. So that's why we're making some changes. The other reason is because things have really gotten different when it comes to how we get paid. So we used to get paid under a block payment system, and we've covered this many times, but that's when you're prepaid for the work. So you get the cash in your pocket and then you go do the work. And this fee-for-service system that we're in now, we do the work and then we wait to get paid. And so this is the progression of that. The first step is that insurance is collected and our payer is determined in the system. The next step is the assessment and the treatment plan happened, and so that contract with the patient on what we're going to deliver is established. Then the services are provided. Then the claim is processed, and then we're paid, right? But why is this important? Well, because of agency cash flow. It's completely turned on its head. So instead of getting the money up front, we now have to upfront the operational costs during this whole time, which include costs to the agency, staffing, occupancy, communications, administrative support, supplies. And the days in accounts receivable, or the time that we're waiting to get paid, could be up to 6 months. And so can you imagine a full day of medical appointments for a psychiatrist, for example? We pay for that today, we pay for that tomorrow, we pay for that the next day. We're not going to get that reimbursement until 6 months from now, and that's pretty scary. And then especially when some of it can be denied. And so we've always known that if there are errors in what we're submitting, there are denials. And so 2 things are key: the timeliness of notes and the correctness of the notes and of the insurance and the payers is also key in order to really reduce all of this waiting and improve that agency cash flow. So that is that second major reason to make these changes. So what does this mean to you? We will not monitor dollars for individual productivity performance anymore. We're going to switch to time in units for individual performance. And units are mostly 15-minute increments. So most positions are expected to produce 400 to 480 units per month. We're also providing guidance on what service codes to bill during this time. This way, you can see, you might have a target of 480, but then should that be spent doing groups or assessments or case management? Well, we give you some guidance on that. The incentive amounts have increased, and this is very exciting. And we're really looking forward to showing that to you. And then we've also developed a more solid structure for disciplinary actions. Now, these aren't new, but it's more of the structure is new, so that some of the guessing work that used to happen is taken away, and you know what's coming, and the supervisors know what to do, and that there's absolute consistency between teams. So we're going to show that to you today. And I'm also going to show you the clarification on the ramp-up time for new hires and for internal staff transitions. So this is the expectation grid. This is what I mean when there's a breakdown. So on the left-hand column, you're going to see that there are the positions. The next column shows you how many units for the month are expected. It's not a goal, it's an expectation. And then the rest of the columns demonstrate how that time and units should be spread out. So for an assessor, we expect them to produce 480 units, and then 25% of that 480 should be in case management, 70% should be in assessments, and 5% could be in the other category. Now, some service codes have different unit increments, and that is true for these. Assessments are actually 1 unit, but it doesn't take 15 minutes. It takes 60 to 90 minutes. So the credit we're giving is 4 units. Same with behavioral health promotion. The Covered Services Guide actually has this code equal 30 minutes. That's how it bills. But we're giving you 2 units for that. Same with these psychotherapy codes. And then this is not new either. It's that we just will continue to filter out bus passes, interpretation, and taxi and transportation. Not the case management associated with these, but definitely these codes. So these codes, there would be no credit in terms of productivity for them. When it comes to performance, there's 2 approaches. There's the carrot and the stick, right? So we are going to talk about how there's an incentive component and there's a consequence component. So let's focus on the middle line here. There is your expectation. So for your full-time employment, if you're in good standing, you're meeting expectation, your expectation is 100% of this expectation. So you have to be at 480. Now, this is an example. This might not apply to your specific position, but in this example, it's 480. Now you could move up and do 105%, and that means it's a 500 unit amount. You could also move down and you could do 95% of your expectation, and so you're really producing 460 for the month. Consequences won't start until 80%. If you are producing 80% or lower, well, we need to start issuing warnings and performance improvement plans. We start incentives a little sooner than that. Right at 110%, we kick in to giving incentives, and the amounts have increased. So if you're at 110%, you get $100 that month if your productivity and quality have been met. So the quality is important, and we're going to review that for everybody as well. This middle part shows you how the units are broken down by days. So this is your monthly expectation. Here's an example of what it looks like for someone that works 8 hours a day and what it looks like for someone that works a 10-hour shift, where they're working 4 10s. Well, if they hit these amounts every day, that's the category they would be in. This is the quality slide. Oh, let me go back. Previous. So productivity plus quality is earned incentive. There are 3 main areas: timeliness of notes, required clinical documents, and data validation errors. And so most of this is all the same. These areas in purple are the new areas. So the timeliness of notes for all staff has gone up to 98% of your notes have to be in within 24 hours of the time of service. For required clinical documents, assessments, treatment plans, demographics, and CASIs, 90% of them have to be current. Now they also have to be timely, meaning they have to be done in a timely fashion. That part is new. Treatment plan update reports for DSP cases is 90%. Data validation, you have to have 10 errors or fewer in these categories. What are the steps to get your incentive? As you know, the service is provided, then the dashboard displays the results. QM and HR both verify that the information is correct, that there are no PIPs on file, and they do this by the 3rd of each month. That part is new because it used to be the 5th of the month. It's been moved up to the 3rd of the month. Since all of your notes are going to be in, that's not going to be a problem. This other new part is that the supervisor is going to sign off on a payroll approval form for the finance team to have on file, and then the payroll department is going to add it to your check. For underperforming, this grid on the top is kind of a graphic that is just a visual representation of our current procedure, that there's a warning, then there's a PIP, then there's another performance improvement plan, and then you're terminated. Now, by the time you're doing your second performance improvement plan, everything should be monitored on a weekly basis, and this could be accelerated. You could terminate before the end of that 30 days if improvement isn't demonstrated. Now, here are scenarios that supervisors can use. If you're in the white, you're good, there's no action taken. If you're in the green, you're giving out incentives. If you're in the red, you're either doing warnings or performance improvement plans or terminations. And we're doing this if there's patterns that are up and down, if they're consecutive, if you're starting to have issues. If you just had a bad month, maybe there's some warnings here or there. This is a complicated concept, but please spend some time with your supervisor on understanding it. It's really a tool for them to use to know when to take a certain disciplinary action. And they're just going to be consistent across teams, and we're really excited for that. The ramp up allowance part is just, a depiction of the current process, which is that when there's a new hire, in their first month, they get a 25% break, in their second month, a 50%. They're not expected to be at 100% of their expectation until month 4. Now, some clarification, if you're hired within the first 15 days of the month, then that month is month 1. If you're hired towards the end of the month, then the following month is your month 1. For internal staff that get a new role and they're moving into a new job, say a community health worker is going to become a care coordinator, we're giving you a ramp up, but not as long. It's not 90 days like for new hires, it's 60 days for internal staff. And so it's 50% of expectation month 1, 75, and then by month 3 you should be at 100%. And this is because you don't have to go to next gen training, and you don't have to learn the agency and some of the longer pieces. You don't have to do Relias. All of that should have been taken care of, and so it should take shorter. You just have to learn the new role. Now, if you're staying in the same role with the same job description, but all that's changed is the location and the supervisor, then we're not doing a wrap-up. And in this example, it could be, say, a care coordinator that was in the East Valley going to the West Valley. They might have even gone through the whole hiring process and interviews and everything, getting a new extension. All of that looks like a new change, but it's the same job. In those cases, we're not going to have a ramp up at all because they should know how to do the job and step right into it. That's the information. If you have questions, please send them to me, send them to a director, send them to your supervisor. Any one of us could help answer them. And the only other thing I wanted to cover is that there is this Excel spreadsheet that has all these tabs at the bottom. The first page has expectations, and then the breakdown by percentage, it gives you the units right next to it. And then these tabs is the same information, but then it's giving you that breakdown for each individual. All the information you need as you click through gives you every position at the agency. And so hopefully these two tools, the PowerPoint and the spreadsheet, will answer your questions, and your supervisor could guide you through this new information. Thank you. The first review for this switchover will be at the January 3rd review, where we're going to see how many units you produce and where you fall on these grids. Good luck to you, and thank you for your time.